Hi, I'm Dr. Gardner, and tonight I wanted to talk with you about distemper. Distemper is a virus that affects dogs, but also affects wild animals like coyote and wolves, and has almost 100% mortality rate in ferrets. It is a virus that animals can contract from infected animals, usually through respiratory secretions. And in unvaccinated animals, it's extremely contagious. It typically first looks like a respiratory infection, coughing and sneezing. Then they won't want to eat, lethargy, can have vomiting and diarrhea. And then it will progress to neurologic signs where they can have seizures, tremors, they can have a head tilt, they'll walk in circles, you'll notice their eyes are twitching. Sometimes they'll have mouth movement that looks like they're quote unquote chewing gum, so that's something to look for. The virus attacks the myelin sheath, which is an insulator around our nerves and their nerves. It has some other functions as well, but it will attack that. And that's one of the reasons that if you have a dog that actually survives the distemper virus, they can have very long-term neurologic problems. It also attacks lymphocytes, which are a type of white blood cell. So a lot of dogs will get secondary bacterial infections. If you think your dog might have distemper, especially if they're unvaccinated, then you should definitely bring them to the veterinarian. They can do a PCR test, and based on that plus clinical signs, diagnose distemper in your dog. It is something that would definitely require hospitalization, and only about 50% of unvaccinated dogs will survive distemper with treatment. And in puppies, only about 20% will survive. The vaccination is excellent, so I do encourage everyone to vaccinate for distemper. It's a series of 4 by the time they're 1, so 3 when they're very young, 1 at 1 year old, and then every 3 years after that. There are titers available, so you can do that too, and I've always had great success with those. It seems like the vaccine causes a very great immune response, so it's an excellent vaccine. And tomorrow, the next night, I'm going to do a talk on long-term effects of parvo, which I chatted about last night, because one of you had an excellent question about that, so I would like to address it. I welcome any questions or comments. I would love to hear from you. I hope that you all find that helpful.